I'm Dr. Jeffery Maehara. I'm the Medical Director of BodyLogic MD of Hawaii. We work out of Honolulu, Hawaii, where we practice anti-aging, regenerative, and functional medicine. My traditional training is ophthalmology, which is eye surgery. I think it's probably one of the less common branches for doctors to segregate out and come to anti-aging medicine. But it's very interesting because in eye surgery, our patients are usually a little elderly. And I think there's nothing more intriguing than watching an 84-year-old patient come walking in on his own accord, no walker, brisk answer to your questions, his mind is rolling, and you see another 84-year-old patient in a walker. You're waiting for them to get into your room. You ask questions, there's a big delay before they answer the question. And you have to ask yourself, what's the difference between these two patients? What's going on in their body? And that together with my subspecialty, which in ophthalmology is glaucoma, and we look at nerves every day. And these optic nerves are just extensions from your brain. Every day I look at them all day long. And again, there's nothing more alarming than looking at a nerve that looks nice and healthy, and you're watching it before your eyes, and it turns into a thin little thread. And you have to think, can we stop this? We need to neuroprotect this patient and do what we can. And that's really one of the major aspects that led me to try and find a different field that can kind of augment and improve our delivery of healthcare to patients. We can give you treatments that are designed to make your body in what we call homeostasis, which is balance. And a lot of the therapy that we use is, of course, bioidentical hormone therapy. These bioidentical hormones are exactly identical to what your body creates. Your body knows exactly what to do with them. Very different than the traditional synthetic hormones. In addition to that, all of our treatments are individually tailored. It's not a one dose, one size fits all. We measure and we find where you have deficits, and we bring everything back into balance. And of course, the patient has to be involved in this, and we help you with that. You need to eat the right things, you need to have an exercise regimen. All of this comes together like a pyramid, and in that pyramid, it's detection, prevention's always at top. We got to prevent you from getting things, and reversal. And we got to get you back into health. And it's amazing that this BodyLogic system is really designed so that I can focus on you and fix you, and that's what I love about it. Our approach is universal, and it's definitively different than a traditional approach. We often run a directed battery of tests that aren't even available to the traditional physicians. We have special agreements with labs that a lot of physicians don't even know exist, but they're scientifically based, very reliable labs. They're run all the time, and they can give us information about food allergies, even genetic testing. We can look at your antioxidant levels. We can find out in particular what is deficient in your body. And that's how we integrate all that information to come up with a very unique approach to try and get you as good as we possibly can. We're going to treat disease, prevent it, and reverse what we can.
I had a hysterectomy when I was 30. And from that, I was on medication Premarin for over 20 years. And so I was having hormonal issues. Last September, I went into adrenal fatigue. The big thing though is I've had chronic pain, bone and joint muscle pain for 20 years. 24/7, I was not sleeping well. And that was the biggest thing, is I couldn't take the pain anymore. I knew I was having problems with the hormones, but the pain was more my issue. So I found BodyLogic online and gave him a call, went to one of his seminars, spoke with him after the seminar, pretty much told him I'm going to be your challenge because I've had 20 years of pain and I can't take it anymore. And he looked right at me and he goes, "It's your gut." And I was like, "What? That simple? What?" So we made an appointment. I ran some tests, a few of the basic tests in the beginning. Went and saw him, kept a food journal, very diligent in doing exactly what he said, trying to be as compliant as he told me to be. And we talked about it, and he told me I need to go gluten-free. And I was like, okay. My body was so racked with inflammation. Every test that he ran, we did the NutriEval test, and he ran another one. It all came back the highest inflammation on every test. That was throughout my body. And within a week, I knew there was a difference. And right now, about a year later, I'm 90% pain-free. I've lost 35 pounds, healthier than I've ever been in my life. He's been really monitoring the bioidentical hormones and the vitamins that he's given me, the probiotics and the other vitamins he's helping me for my food to be processed correctly. So that's what I like about Body Logic. It's not just one thing, he's taking the whole picture. He's looking at your physical, your nutrition, you know, your chemical. That's what I liked, is the whole picture is being looked at.
If you'd like more information about Body Logic MD, you can go to our website at bodylogicmd.com. It's separated by location. You can click on Hawaii and you'll be able to get in contact with us, and we can provide you additional information, and we'll get you a lot healthier.